We do have a quorum. We have a bill up later today too. Thank you, Commissioner Malcolm and Department of Health staff for coming today. I'm sure committee members are getting tired of our weekly vaccine discussion. Like I said, that we do have a bill today, but it is so very important that the public knows what's going on with the vaccine and vaccine distribution. I know I'm not the only one here who has received numerous emails, texts, and phone calls from seniors so frustrated, scared, angry, and confused and disappointed that they haven't been able to get the shot. They don't know where to get the shot and have tried to figure out how to sign up for the shot, but it either doesn't work or the system changes or they've been told to try again later. Members, in your packet today, there's a letter from AARP. And after hearing from their members about the frustrations and confusions surrounding the vaccine and the vaccine rollout, they did a survey of their members last week. And in it, some people actually went so far as not just taking the survey, but to add comments. And I just wanted to read some of them because this is, I'm sure, exactly what you're hearing in your inboxes. This is from Daryl from Plymouth. Every avenue I've tried is a waste of my time. My doctor is not giving shots. My health insurance says wait for a phone call. The Minnesota COVID site leads to some places that are supposedly giving vaccine shots, but when I go online and try to schedule one of them, I'm told there are none available. Bryce from North Oaks says, very frustrating. System by Minnesota Department of Health is very chaotic and fragmented to many different, some non-existent avenues to receive a shot. There should be a more efficient, singular way to sign up for a vaccine. The selection of recipients could be prioritized by relatively vulnerability to severe COVID outcome. Those signed up should be able to be updated on a daily basis as to where they are on the list and contacted well in advance to arrange an appointment. Too many will not get the vaccine in a timely manner the way it is going now. Then there's the issue of the lack of transportation as a barrier to receiving the vaccine. This is from Kay in Minneapolis. I've called and they gave me a choice of location I could go to what was the closest to where I live, but I don't drive in that area. I'm limited to locations because of my age, and if I don't know the area, I get lost, and I couldn't find someone that could take me, so I didn't make the appointment. I'm going to call again tomorrow to see if there's a closer location I can drive to and see if I can get the vaccine. I think people my age, 82 plus, who still drive and have trouble driving to, I think people my age who still drive have trouble driving to unknown locations. And then I just received one like 2 minutes before this committee from Rick in Redwood Falls. He said, something just doesn't seem fair. I'm 61 with prostate cancer and still not even able to look for the vaccine. Meanwhile, many others with no health risk and much younger can get the vaccine. Some states are including the same essential workers as Minnesota, but limit it to those 50 and up first. I highly urge to start looking at health risk as a top priority. After all, that is MDH's job to begin with. I know Mr. Walz has the final say, which I just found, I actually printed this off because I can't find it anymore on the MDH's website, where it says that the final decisions about how to distribute COVID-19 vaccine ultimately come from Governor Walz. He said, I know Mr. Walz has the final say, but someone needs to tell him point blank, please at least have a plan. Maybe start groups by descending age. I am pleading for someone to do something for us. We need to get our vaccines before the hospitality industry starts. This is about health, not just about getting people back to having fun. You can't have much fun if you die from this because of bad choices made by the Department of Health and the governor. So bottom line, it's been a mess. 1 week it's pilot sites, 1 week it's a website that crashes, then a phone number that sends you to the crashed website. Then the department hires a new vendor and we have something called a vaccine connector that is no better than the less confusing website that we had previously. We now have fake sites popping up online telling you to register for the vaccines, not the Department of Health's websites. They are now overseas company preying on our most vulnerable, popping up, register here to get your vaccine. And seniors are going in and putting in their age, their phone number, their home address, whether they live in a group home or a single family home, or if they have comorbidities. This opens up a whole new opportunity for criminals to scam our seniors when we've worked so hard to protect them. Our seniors are confused and they are desperate that they're signing up at these sites in hopes of getting the vaccine. So at today's hearing, I've invited the Minnesota Department of Health back to continue discussion with our committee about the vaccines. I'm glad Commissioner Malcolm was able to make it. Understanding that the Minnesota COVID-19 vaccine plan is important for all Minnesotans, but especially for our vulnerable seniors. Minnesota families deserve to know the details of who has been prioritized over the last 8 weeks within the state's limited supply, how are vaccines being distributed, and what is the upcoming plan for the next stages. It's critical that we have tough, real, candid conversations about vaccines in a public venue. COVID-19 vaccines will impact every family in Minnesota one way or another, and they all deserve the fullest transparency from their state government and the governor about his Minnesota vaccine program. I did send a document asking many questions and for the response to the department, and I want to thank you for providing the written response to my February 16th letter. I believe it's very important to have this conversation and share the data in a public setting. Again, the public deserves transparency, which I feel has been consistently lacking from this administration. Unfortunately, not all of my questions from February 16th or January 26th that I posed to the agency were answered. Members, you have the information that was emailed to you. Feel free to review. However, I'm not planning on spending much committee time on this today anyway. If you need an example, we asked very specific breakdown questions in the last meeting within the 170,000 of last week's allotment. Asked the Department of Health when they got the 170,000 of the week before's allotment. The response, Commissioner Malcolm, was this information changes on a weekly basis since not every provider receives vaccines each week. It is best to look at the Vaccine Finder website, which lists providers and the populations they serve. And I can't find any of the information on the website, and it certainly doesn't tell me the numbers or give me any of the specifics I was looking for. I also asked what providers are listed under the other category. Please provide a full listing. And the answer was during the February 17th hearing was to say that 2 groups, just 2 groups and not specific. And this doesn't really count as an answer. What does 2 groups mean? So anyway, instead, I want to discuss a few emerging topics related to the vaccine and have a dialogue with you and the committee to bring the feedback we are hearing from our constituents and those that I read earlier that we represent, actually from seniors and their families around the entire state. Commissioner, I know we share the same desire to protect Minnesota seniors. However, I disagree with the way the governor has handled the prioritization and the execution of the vaccine program for our seniors in Minnesota. His words say seniors are a top priority, but the actions are very, very different. The program has been chaotic and ever-changing from the beginning and continues to be 2 months later. So what's next? I think we should go to the Vaccine Finder. I don't know, staff, if you can pull up, not the Vaccine Finder, the Vaccine Connector. I actually went, and I don't know if everybody has done this, but I did it just the other day because I wanted to know what this new Vaccine Connector was all about. So if any members haven't signed up for it yet, I'll go through. I did this on my phone the other night. So if you can play it at the beginning, it is the intent of the state to collect the data. I'll wait till you get that up, Suze.
It'll just be a minute.
Say that again.
It'll just be a minute.
Okay, all right, that's good. Maybe we'll go to, or should I wait for you to do that, Susie Giroux?
Morning, Madam Chair.
Oh. Hi, Commissioner Malcolm.
Wanted to say hi while we're waiting. We have just a few slides we'd like to show at some point, if that's all right with you.
Okay. All right. Thanks.
And
Yeah,
Madam Chair, while we're waiting,
Yes, Senator Rude?
I just wanted to say that I did get an email from our friend Leora this morning.
Oh, yes, Leora.
Leora, she's a 96-year-old senior in New Ulm. And she just wanted to express how grateful she is to the Senator Housley and the members of the Aging and Long-Term Care Committee for working so diligently on the behalf of seniors who so desperately need to be vaccinated due to the high risk of death from coronavirus. And she received a notice that she is going to be vaccinated on March 10th. So she's very excited that she has a plan going forward. And she just wanted to really express her thanks to the committee for their advocacy. So thank you.
No, thank you. And Leora, keep us updated as to your shot and your reactions and your second shot. That's good. I'm glad we were able to help. Thanks, Senator Rude. Okay, so this is and members, if you have any questions as we're going through the Minnesota COVID-19 vaccine connector, this is the website that you go and sign up. So the beginning is where the notice of intent to collect our private data. So I don't think I can hit play, Susie. Nope. Go ahead, Susie. So it is it took me 6 minutes to go. We won't go the full 6 minutes, but here it says that state agencies involved in vaccine planning schedule will have access to your information. Others who may have access to your information are local public agency, healthcare providers, and other persons or entities involved in COVID-19 planning, scheduling, or administration, as well as the persons or entities authorized by law. So the first question is, are you a first responder who provides direct patient care as part of the EMS system, or healthcare workers, or do you work in a healthcare facility? No, I'm not. Do you work in childcare, pre-K-12 education? No. If you are employed, can you work from home? These are the first demographic details. Oh yeah, and there's, there we go. Do you work in any of the following industries? Check all that apply. How come I'm getting yes, no? There we go. Correctional setting, energy, finance, first response. So again, collecting this information of where you work, of food service, legal, manufacturing, public safety. I was actually looking for real estate, was why I backed up. Asking questions of this is before the senior goes to put in their age, address. They want to know where they work. What industry do you work in? What job title do you call yourself? What's your employer's name? Again, inputting all of this data. I don't know why they need to know where I work, but okay. Then they ask your race. And I can understand, and I know Commissioner Malcolm, you've told us that before, the reasons you're collecting the race to see if some are not signing up for the vaccine more than others. Ethnicity, again, this is all before they ask the age. Then we go to describe your gender. Male, female, transgender, other, prefer not to say. And I know, Senator Rude, you've heard from people in your district quite irate that why are we asking these questions when I just want to sign up for the vaccine, which again goes to 89% of those who are dying in Minnesota from COVID-19 are our seniors over the age of 65. Number one criteria should be, I think, when you go to a website like this, how old are you? 98% of those are 50 years and older. So why we're collecting this data, your gender, and then we go into what's your sexual orientation, and then straight, gay or lesbian, bisexual, I don't know, something else, prefer not to say. I'm actually a little frustrated that a senior would have to answer these questions when they've already, and you've heard the testimony, scrambling, trying to find a place. By the time they get to this, they've quit, I'm sure, signing up for this, because they don't need to answer these questions when they just want to sign up for the vaccine. Keep going, Suze. Preferred language, this is a long one. Fast forward through this, so many different languages. And why do you need to know if my first language is Norwegian or Polish to get the vaccine? Are you 65 or older? Are you 65 and older and speak Polish? That's great, but we don't need to know that information. Why does the government need to know this information? And I did, in the last press conference, or in the last legislator update, someone from the Department of Health actually said there's an appetite at the department for this data. And it was extremely disturbing to me that there's an appetite for this data. Do you need an interpreter to assist you? Please tell us. And again, please tell us if you have any of the following disabilities. To get the vaccine, you need to know if they are deaf or having serious difficulty hearing, or if they're blind or serious difficulty seeing, even wearing glasses. I'm having a tough time seeing this without glasses, but nobody needs to know that. Serious difficulty walking or climbing stairs, dressing or bathing, or physical, mental, or emotional condition. You want to know if somebody's depressed before they can get the vaccine? It's just so maddening that these questions are even being asked. I think they all should be deleted. They all should be deleted. Number one question. Oh, wait, we're not even there yet. How old are you, senior? We're not there yet to what's, oh, then we got to know everybody's medical history. I'm just going to let them go through because I just get all riled up. Heart conditions, severe obesity. Now we get the name. Oh yeah, that's the other one. There it is. Why do you need to know if they're living in a college or university, or if they're outdoored or unsheltered, or if they're living in a group home? Why? And so, Commissioner, maybe you can answer some of these as we finish this up. Why do you need to know where they live, what type of place they're living in? Doesn't make much sense. Oh yeah, single family home. Thanks, Sue. That was the other one. I was like, okay, I think only Minnesota residents should be in there, but Washington. Can I receive text messages? Email address. So anyway, I don't know if members, you have anything that you wanted to add about the vaccine connector and the sign up, or if you've tried it, or if you have any questions on the data that is being collected before they get to, wait, we're getting to my date of birth. I don't know, and my Gmail. So finally, this far in, they're asking how old we are. And I'm not saying seniors aren't tech savvy, but many people, especially if now we know that they don't have a roof over their head, definitely know they don't have access to a computer. But finally, they're asking what is your date of birth, which I feel should be the number one criteria in getting the vaccine. 89% of our deaths, 65 and older, 98% over the age of 50. Now the insurance information. So anyway, members, I don't know if there's any, oh, wait a second. I just lost my screen. There we go, going through to the end. Oh, that's right. So here we go. And I scrolled through it fast and I shouldn't have, but you have to verify all of this information is correct. And you pretty much are just signing over everything that you've put in there is now public data. Everything from where you live to what language you speak to if you're overweight and depressed, all of it is in there and is public data. And we all know the debacle of the MNLARS breach and all of the personal data that got out there. This too is you're uploading this into a government website and one that I would not trust. And I don't know why there's such a need to grab all of the data. I don't know if the department's on a data hunt, but members, you can ask questions or Senator or Commissioner Malcolm, I will, oh, who can get vaccinated now? That's where we're at. Oh, and I called the phone number for you to be able to opt out. Did I miss that? Anyway, there's a phone number at the bottom that you can opt out, but you've already put all of your information in. And so you can't erase it once you've put it all in there. So members, that is the vaccine connector. A data grab by the department makes no sense to me. Other states are just asking how old you are and giving you direction. I'll go to Senator Curran first, then Senator Abler.
Thank you, Madam Chair. Commissioner Malcolm, of all of the plethora of data that you're collecting, please describe exactly which of those criteria are driving the decision-making to offer the vaccination to anybody who walks through that lengthy survey. What data elements are actually driving it?
Madam Chair and Senator Curran, thank you for the question. I'd like to, if I could, respond to why are we collecting all of this data? And could I just also, Madam Chair, just say that your point about moving the age question up higher in the form, we agree with. We've asked Microsoft about making that change. This is not a product that was completely developed de novo for Minnesota. So I just wanted to address the question that, we agree that having the age question up higher would be helpful. Senator Cran, your question about all this information that we're collecting, the whole intent here is to be able to use this to communicate with folks who voluntarily sign up to get them information when they are now eligible, where they might, and to help connect them with ways to register for actual appointments with their clinics, with their pharmacies, et cetera. So getting the data on occupations, for example, will help as we are working with different workforce sectors, how we can communicate about workforce-based vaccination opportunities. The medical conditions will be very important as we start getting into underlying risks so that folks, as different conditions are being vaccinated, that we can reach out and tell people that. So the whole idea is to get information that will allow us to help people navigate the system and to get them connected with vaccine opportunities. We're not using this data for prioritization decisions. That whole process is driven by a federal guidance framework and by our own analyses of how do we best vaccinate for impact in terms of health protection, as well as for critical societal functions. We've had the conversation in this committee before about the fact that I respectfully disagree that we are not prioritizing our elders. We have made tremendous strides in immunizing in long-term care settings and now in community settings. We agree that the vaccine supply has been inadequate to absolutely fill up all the vaccination channels that we want to, so people can get vaccinated at their clinics, at their local pharmacies, and the like. But we're making good progress. And we are reporting that progress daily on the website, what percentage of which populations and which age groups have been vaccinated. I believe we're now at almost 42% of the entire 65 plus population, we're approaching 80 and 85% of long-term care residents having been vaccinated. So we have made a lot of progress on vaccinating priority populations. We talked before in this committee about the importance of vaccinating healthcare workers who take care of all of us, including our most vulnerable. And the other priority population so far has been educators to help get our kids back in school. And we've talked about that. That may be a difference in view about whether it should be exclusively the elderly or whether it's also important to prioritize some of these sectors that help our society function, help keep people get back to work and the like. So Senator, your question, I think, was, are we using this data to drive prioritization decisions? No, we are using this data to drive communication strategies to help target information to people so they know when they are eligible and where they can go to be vaccinated.
Madam Chair, follow up.
Senator Curran, sorry. Go ahead.
Thank you. Thank you, Commissioner Malcolm. Then what we would love, well, two things. One, you just described that, well, it's unfortunate. We've asked the vendor. You own this process. You are the director, you are the commissioner of the Department of Health, the chief person in the driver's seat. And to have a vendor come in with a solution that doesn't meet our needs right from the very beginning is unacceptable. And so the top thing, you list the very last page after you've collected all of your specialness data, the very last page or the second to last page is, here's who's eligible. That should absolutely be the number one page, who's eligible, so people don't waste their time filling out the information. And you really don't need, if they fit in that eligibility category, you don't need all of the other data besides the pertinent, who am I, you know, and sexual orientation, gender identity, all of those things have nothing to do with determination of the eligible criteria that your own page says who's eligible. So with that, then I would ask that, one, we get that fixed right away. We're talking about, you know, the vast majority of Minnesotans have very limited access to the internet, and certainly our elderly population have even less or less sophistication. So I would suggest we get that fixed right to the top. The vendors work for us. I was one of them vendors my whole life. I would never go out there and say, oh, I'm sorry, you're gonna live with what we have. It's unacceptable. You've had a year to plan for this. And so you need to get that. So then we would ask, under the guise that you've been also so transparent, then give us the exact selection criteria and the prioritization and how those people or how the data is being utilized to set the priority and who you're going to offer vaccinations for. Shouldn't be that complicated, pretty consistent algorithm. I'm assuming there's a series of boxes that you can check and that the vendor that you've hired would have that available. And so we want that detailed information. The most frustrating piece for us is being able to walk through and understand what our plan is. Did you, Commissioner Malcolm, I don't think you were there. We had a gentleman in from I think West Virginia. It was great. It was wonderful. We learned more from that gentleman in 45 minutes than we've learned in this committee and the HHS committee about our plan. They had a plan, but their plan was focused on the solution and the greatest needs. It wasn't focused on political correctness, political pandering to a population that puts more senior citizens, regardless of where they live, regardless of their ethnicity, their race. Senior citizens over 65 have the greatest risk of mortality or of fatality. And we keep dancing around why we're not making them a priority. And so anything other than that is to me going to be seen as not trying to solve the greatest problem and the greatest need. So we really would like the criteria that's being used to select it. And so thank you, Madam Chair. Very frustrating to go through this process.
Madam Chair and Senator Cran, I'm sorry, I just don't understand the characterization that seniors aren't a priority when the entire population residing in skilled nursing facilities and assisted living and other congregate care have been the first priority. We immediately opened up to all 65 plus as soon as the federal government said that was okay to skip to what had previously been a much later tier in the prioritization process. We have been immunizing 65 plus now for a month. We are making good progress. They are the top priority. I think the only other populations besides healthcare workers and the long-term care residents and the general 65 plus population, the only other population that's been prioritized is teachers in childcare. So I'm sorry, I really don't understand the characterization that seniors are not a priority.
Commissioner Malcolm.
Madam Chair.
Oh, I just want to jump in here with Senator
No,
Coran.
go ahead.
The nursing homes, those vaccines came from the federal government, so that was a program that was their vaccines, and I know that finally started to go smoothly after a lot of frustration. But when you move to the 65 plus category, you're not saying that they got 100% of the vaccines to 65 plus. They have been diluted amongst many people, and 15,000 dose pop-up site at the Roy Wilkins auditorium for school teachers and child caregivers does no good for our 65 plus community that are those the highest risk of dying. So the percentage of doses going to our seniors is not even half when we've got 90% of them 65 and older dying. And again, 98% of them are over the age of 50. And what percentage of teachers and childcare workers are dying from this? That's prioritization. Senator Coran.
Yeah, and Madam Chair, it just goes back to we've talked about these priorities, and every week we seem to get a new list of other priorities diverting to away from the seniors. 40% of we've done the stance for the last couple of weeks of 40% of the total vaccinations going to the population of senior citizens, and we understand critical care workers, and there are a variety of other groups. But for the last couple of weeks, well, we're just about done with those groups. We're just about done with those groups, and we're going to really increase the availability to say they're eligible, but actually making moving the doses over to the priority of the senior citizen seems to be a huge disconnect. So, Madam Chair, I'll let others have an opportunity to ask questions. Thank you.
So I guess, Commissioner Malcolm, that's what I would actually like clarified. How is that prioritizing seniors when they're getting a small percentage of the doses that are coming to the state of Minnesota, yet the governor can go and say, we are vaccinating 65 and plus. Yeah, I know you are vaccinating those 65 and older, but not more than. It's actually a lot less than the other sectors. How is that prioritization?
Madam Chair, I'm not sure if my colleague Chris Erzman is on the meeting.
Yes. Yes, I am.
Let's get you that percentage of doses that have actually been allocated to 65 and over. I don't believe it's accurate to say that it's the minority.
And Commissioner,
the large healthcare worker population certainly was driving the numbers in the beginning. Yeah, Chris, go ahead, please.
Oh, Commissioner, Madam Chair, Committee, this is Chris Erzman. I just did want to clarify that the doses that were given through the federal PPP program, those were Minnesota allocations. They did not come from the federal government. They were from our allocation. So those are all Minnesota doses, just to clarify. So that is part of the Minnesota allocation. And
but you were required to give those to the nursing. Those were allocated to go there. So you couldn't change those at all. Those ones that you got to decide.
No, we could decide how we use those doses. And we chose to put them there. So no, it was not, there were guide rails for the program, but we got to choose when we started the program, when we allocated the doses, and how many doses we allocated. So that was all a Minnesota decision. And when we looked at the things, just to clarify, the things that we did was we worked to diversify the providers that were part of that vaccinating our elders, because we wanted to make sure that there were more providers so that it could go more quickly, because with the limited providers in the federal program, we knew that that would necessarily kind of back things up. So we tried to diversify and get our facilities assigned and linked to other pharmacies in Minnesota just to help speed that process up. But yes, just wanted to clarify that. And we do have a slide actually that looks at the proportion of doses just in the last week that went to seniors. So I don't know if you'd like that to be shared.
Sure, you can share that slide,
Okay.
and then we'll go to Coran Enabler.
Yep. So Dan or Lisa, if you could, thanks. So this just indicates for the week of Valentine's Day, 68% of the first doses that we had in Minnesota went to our senior population.
What do you mean by the 68% of the first doses?
Just that I think as we discussed in prior committees, there are first doses allocated, and then, you know, as an example, we vaccinate 100 people in a long-term care setting with first doses. Those second doses are reserved, and so they're going to come automatically. So we always, so they will get those second doses without question. And so that's why we always talk about the first doses, because the second doses are allocated automatically. So of the new doses that could go to Minnesota residents, 68% went to our senior population.
And where were those? In long-term care settings?
No, actually, it was a combination of settings. So as the commissioner, I guess it's been myself and Deputy Commissioner Kelly as well. But as we've indicated, the ecosystem for vaccinating in Minnesota is broad. So this includes pharmacies, the vaccination that's happening in our long-term care settings, as well as at the mass sites, as well as at healthcare providers. So it's a diversity of providers who are helping us get those vaccines administered.
All right, Senator Abler, you have a question.
Thank you, Madam Chair. And, you know, I saw the agenda. I thought, well, I've kind of been through this discussion before. I think I'm just going to watch. And then as I really appreciate you going through that, that vaccine finder, whatever that thing is called. And I admit I have not looked at it that closely. When I looked at that, I thought, who would ever fill this thing out? And so then I was sitting here just ruminating on all of it. And so the information there is so vitally private. And the government has been proven to be so incapable of protecting that information. Then I just kind of stepped back a little bit. It's been a year, Madam Chair, and maybe you remember this. For a year, one person has unilaterally told us what's going to happen. And in that year, we have lost so many freedoms that have not had a benefit in saving one life. Some of those steps should have been taken early on, but we've lost our friends and our families. We can't go to funerals. I went to a drive-by funeral, Madam Chair. Our businesses, many people have ones that are never going to open again, and no lives were saved. We've lost, did I say churches, schools, school sports, and people are like getting used to it. And like, oh, that's fine. It's for the good of the order. And those folks are really smart and they know what they're doing. But now it seems like they're getting hypnotized. And now this is what you've taken away a lot of our lives. So now you're taking away what's in our heads and in our private world. And for no particular reason, except for an appetite for data. In a software program owned by a company, Bill Gates owns that company. And there's all kinds of stuff about behind the scenes about what is he up to, and I don't even know, but his name comes up sometimes. And why would we take a program that was so inclusive as this and just take it? And I don't sit on thinking of conspiracy theories, Madam Chair, but I do want to caution. I would never fill out that form. I just wouldn't. I can't see my mom sitting and filling out those questions. And you know, we learned in the West Virginia discussions that when you actually work together and decide what you're trying to accomplish, that people accept it. And people like me and you don't have to ask questions at committees like this. We could actually focus on other long-term care issues because there's many issues, but we don't know where else to go. And you and I have reached out to the governor on more times than we can count. Would you please include us in the decision-making? Would you please make this a collaborative effort? And what we keep getting it's one more magic. Here's the magic box. So it's going to pop out of the magic black box next week. And and here out pops this little questionnaire thing. Out pops really, I think at least a half-hearted effort at making sure seniors are taken care of. But I don't know, Madam Chair, where to go with that. But I'm just really disappointed. And Commissioner Malcolm, you look great today, by the way. I wanted to point out to you. And Commissioner Malcolm, there's nobody I would rather have be at the head of this than you for what you know. But I'm really sorry the governor has tied your hands to include so many of us the way you have. This is a governor's decision. He just feels like it's all on him. I've told him when I talked to him the 3 times last year and no times this year, because he hasn't called me back, to share the load, to work with us. Let's solve this and be on our way and quit politicizing all this so much. I guess that's maybe more of a statement than a question, but Madam Chair, I think you're spot on with your concerns. And I think it's our duty as legislators to help hold the system accountable as best we can, if it's only by talking. So thank you, Madam Chair.
Thank you, Senator Abler. And to your point, that nobody else asked those questions. If the feds, they don't ask it, the VA doesn't ask it, the Indian Health Service doesn't ask it, the federal pharmacy providers don't ask it. It is only here at our Minnesota State Vaccine Connector that they're asking these intrusive questions, which makes absolutely no sense. Senator Rude, you have a question. Oh, you're on mute.
Not much as a question is just a comment. You know, I have consistently asked for the commissioners and the Department of Health to please look at this from a senior's viewpoint. And it's obvious from this new vaccine connector that really isn't happening. It's such chaos for them. And I did this, the first thing that came out, I went in and tried to do it and I couldn't get past the second page. I thought it was so obtrusive. But I have to tell you, so think of yourself as an elderly patient that is not going to be able to do this program. They're not going to pick drop boxes. They're not going to be able to do this. So they're going to have someone help them. And so I can't imagine being a senior, having someone help me through Vaccine Connector. And whether it's my son or my daughter or my neighbor or my caregiver sitting down with me and asking me at 85 years old what my sexual preference is and what's my gender preference. And I really don't think that any senior is going to probably get past that page. And I don't know why you would go there. It's just so, it's so unnecessary for a senior. And so all the questions are nothing to do about seniors. And then you wonder why we say seniors aren't a priority when this vaccine connector obviously is not a priority for 65 and over, it's just not. And it's the newest program to roll out, from the website to the lottery to the pilot programs to now the vaccine connectors. And so I just ask you, please look at it from a senior's viewpoint, how they would look at doing these things, because I don't think that's ever considered in the chaos that's been created for them.
Thank you, Senator Rude. That's the same thing I was thinking when I was going through it. I was just appalled. And I actually, Commissioner Malcolm, and I know it's not up to you, but I think you should take all of those questions down. I think there's absolutely no need for it, no need to collect that data. And I guess I'm asking you, will you consider taking all of those questions off and just stick to what you need to know, but their name and their age and their address and where they can go?
Well, Madam Chair, thank you. I would like to respond to that. Let me say first, I totally understand all the points that you're making about the confusion for seniors, the difficulty of navigating the systems. In no way do we think that the connector is the end all and be all way of people getting or giving information. It is a tool that, almost 400,000 Minnesotans have found helpful. We have encouraged everyone to sign up for it so that as eligibility expands, as vaccine expands, they've got a way to know that they've registered their interest and they're going to be getting information. Your points about moving the questions around in order, I think, are well taken. We're working on that. I think the information, though, you ask about, disability, why do you need that? We need that so that we can make sure that there are accommodations if people are showing up at a state site, for instance, to be vaccinated. The health conditions are going to be, I think, quite helpful to being able to let people know when those conditions are being vaccinated and where. So I think it's intended to be a source of information, not an appetite for data on the health department's part, but a desire to be able to communicate with people in specific ways that apply to their situation. We don't think that all seniors are going to certainly use the connector. The main way seniors are getting vaccinated is by their healthcare providers, and as the pharmacy programs expand, by in their local pharmacies who are, and we have the original state sign-up list, which the connector was intended to be an improvement upon that. All those people who have voluntarily said, yes, I'm interested, please put me on a list, please let me know when I can be vaccinated. We're able to share that information, and clinics are reaching out to their patient population right now to encourage people to sign up for appointments. And that's that I know can be frustrating for people to be waiting for that call, but that was our attempt with the vaccine connector, was to be really clear about who's being vaccinated now, and how are those vaccines being distributed through pharmacies, through that vaccine finder website, but primarily through their healthcare providers. And most seniors, I think, will be served through the healthcare provider system and their local pharmacies.
So,
Madam Chair, I have a follow-up, Madam
yes,
Chair.
Senator Root.
Well, Madam Chair, Commissioner, I think you've done a great dance to not answer the question. You have done a great dance. We do disabilities, jobs, age, but I need to know why you need to know gender identity and sexual preference to get a vaccine. And you've not addressed that in one answer. And I'm just going to ask you point blank, why is that a necessary thing to get a vaccine?
Madam Chair and Senator Rood, let me clarify. None of the answers on that form are necessary to get a vaccine. They all clearly say what is voluntary. It has nothing to do with whether people will be able to get a vaccine or not. It's data that is useful to know what populations we're serving or not, but those are not eligibility questions for the vaccine.
No, but you cannot fill out this. It's a starred preference, and you cannot finish signing up for the vaccine connector unless you provide that information. You cannot get past that. They are starred, red starred, and you have to fill it out in order to use the vaccine connector. And I find that just really, those questions need to be gone.
There is the option to not answer. That is an allowable answer. Prefer not to answer. But I understand your concern.
Commissioner, but you still have to answer, prefer not to answer. So you still have to have the question in front of you. And that's why even collect that information when you don't need it. And of the 400,000 people that have signed up to the vaccine connector, it's become helpful to them. It has not been helpful to me. It's been helpful to you because you've collected all the data. They've got no information except a welcome to the vaccine connector email. That's all they've gotten. And if seniors are supposed to be getting it from their healthcare provider, why should they even go to this site?
Well, Madam Chair, it is useful for doing things like saying when Hy-Vee, for example, gets added to the retail pharmacy program, and we have, through this information, the ability to send out an email to everybody on the list to say, in your geography, the following providers are now vaccinating. So people are getting communications from the connector that are targeted to their location and their eligibility to let them know, here's a new provider that's got vaccine. So it is not the purpose for collecting the data are for the ability to target communications back to them that will be helpful to them, that will help them navigate and just to know the current status. So that was the intent.
Commissioner, respectfully, this is information that should only be between a healthcare provider and the patient, not government. So I'm sure some other members on this committee are going to demand that you take those questions off because they should not be asked by government of anybody. Senator Eakin.
Thank you, Madam Chair, and thank you, Commissioner Malcolm, for being here today and answering our questions. We really appreciate that. I know the progress is being made. There are issues that I think still need to be addressed, and I think simplifying the system for seniors in particular is important, and making it as easy as possible for them. And I think that it's important to note that there's I don't think there should be any questioning of motives here as far as the department or the governor. I know that their intent, as in your intent, is to protect people and try to get society back up and running as quickly as possible. And we may have some disagreements as far as how to best accomplish that. I, for one, do agree with Chair Housley about the need to prioritize more seniors and are more vulnerable. One thing that I think we need to keep in mind, and I mentioned this in an earlier committee hearing, and Commissioner Malcolm, you weren't at that one, so I wanted to address it directly to you, that the most vulnerable includes more than just people over the age of 65. There are many under the age of 65 who have serious underlying conditions that makes them extremely vulnerable and are threatened by COVID as a result. And that needs to be taken into consideration. And part of the issues that should be asked about, I think, should be, how much personal care service that's required for an individual. I know that, group homes have been one of those areas. Other congregate settings have been targeted. But what about those who are living with their parents and receiving significant care from home? If they, there should be a way, it seems to me, that we should be able to reach them as well, because there are many of those who, receiving COVID would be almost akin to a death sentence. This is very serious. And I think that we need to include them at the top of the priority list. There's many of them that are even more vulnerable than many over the age of 65 that are in good health. So they should be, I think, at the very, very top, along with those who are in nursing homes, those who are in other congregate care settings as we move forward. So I would just encourage that be added as well to the priority list. I also have made it clear in the past that I think that, teachers and childcare providers, while important, essential workers to our society, most are, relatively younger and better health. And can afford to wait, whereas people with these underlying conditions and people in the higher age groups can't afford to wait. So just wanted to express my opinion on that, but I want to thank you for the work that you've done. I'm hopeful that we can work together to address the concerns that we have here on this committee. And again, thanks for being here, Commissioner.
Thank you, Senator Eakin. I had a question to your point in the questions that are being asked in the prioritization. Are any of those answers that people giving in the vaccine connector, are you using them in determining who gets chosen in any way? I know the governor always speaks of his equitable distribution. Are you using the answers to those questions to meet your equity targets?
Madam Chair, we are using those data and data from healthcare providers on who is getting vaccinated to make sure that we are reaching all the populations in our state and reaching those who've been disproportionately impacted by COVID. So it's a way of being accountable, to being able to measure and to know who is trying to get access to the vaccine. Are they who is showing up at these various sites? Providers are trying to get a better line of sight to that. And certainly we have that information from the community vaccination sites that that we have set up. But these data through the connector are not about picking the next priority groups. It's about, making sure that we are communicating with people and getting them, again, information that is tailored to their situation, their geography, their age, their eligibility status.
So you are using that data to see what percentage of each one of these communities, equitable communities, are getting it, or
signing up. Yeah, I mean, this data, we have to compare this data with, the end of the process, the information on people who've actually been vaccinated, to make sure that we're actually serving those communities.
All right. Again, I'm going to ask that all of those questions be taken off and just the basic questions be on that vaccine connector, because I feel they are far too invasive and the government doesn't need to know that. That is all private information. I actually, Senator Hoffman, is it to that point? Because I'm just going to move on here. To that point, go ahead.
I'm wondering, Commissioner, when we start to talk about equity and we talk about categorical identification factors and getting certain numbers, one of the things that's always missing is there's an intersectionality of people with disabilities throughout the whole thing. Disability doesn't discriminate based on anything that's there. Disability, we have the highest unemployment, we have the highest, you name it, it just factors in there. When you start to add in all that intersectionality stuff on it, it just creates an even larger spotlight looking at why are we not including that? And so when I hear the conversation about equity, I question and challenge that, saying, where are you doing that intersectional conversation with that? And I can give you lots of examples. There was a book that was done under the Dayton administration. There was a Young Women's Initiative, a Young Women's Collaborative, and they did their blueprint for policy. And in there, they specifically talked about that. And there were so many highlighted individuals within certain categories. And they said the biggest discrimination they had wasn't based upon their categorical reservation on that piece, but it was based upon their disability. And so I'm wondering, are you including intersectional conversation within that when you're doing those segmented equity conversations? Because if you're not, then I'm sad to say you're missing the boat on this. But if you are, thumbs up to you, Commissioner. So will you please let me know how that is going?
Madam Chair, Senator Hoffman, thank you. And it's an excellent point about intersectionality. And we know quite clearly that, the factors for poorer outcomes in COVID are age and certainly the conditions that, and you make this point correctly, a person with a disability can have a very different experience with a common condition than someone without a disability. So that those issues do need to be taken into consideration, and are some of the things that we're working with providers to figure out. And again, I think for the folks who need vaccination from a clinical perspective, we expect that it's the healthcare systems that are going to be doing the majority of that vaccinating and working with us to do the outreach to find those populations, get them in on a prioritized.
You're not doing it. Correct. And I thank you. I didn't mean to cut you off, but I'm sorry, but they're not doing it because they're not being told this is what they should be looking at. If the system isn't set up to where they're saying, here's a priority and here's why, and then everybody in this room, and I can quote because I don't forget a thing. Senator Abler talked about that. Senator Housley talked about that. Senator Eakin multiple times. Senator Curran brought that up. Senator Putnam did last week. Senator Rude. I mean, I can give you those examples, but those anecdotal examples really tell you, is the system set up to really address that? And based upon what I heard Senator Abler say last week, it's telling me that somebody isn't allowing that full system to understand what you understand, Commissioner, right? You understand that intersectional thing. So it's like, how can we help you get that point across? And I'll give another example. I'm still a little miffed that my 68-year-old sister-in-law had to drive to Brainerd. Now, nothing against Brainerd. Senator Root. So no, but it's like, where was the system response to that? But that's beside the point, Commissioner. But I wish we were more purposeful and intentful when we talk about including those most vulnerable within this conversation. And it has to be intersectional. And I'm done. I'm off my soapbox. But thank you for your time.
Thank you, Senator Hoffman. So moving forward, we have seniors that have missed last Easter. They've missed, they haven't been able to be with their family since last Easter, skipped it, did church virtually last Easter, missed their birthdays, missed Mother's Day, Father's Day, Christmas, Thanksgiving, and now we're approaching next Easter. And they're wondering, are they going to be able to get the vaccine, get out there, see their family this Easter? I just want to talk about what is next. Are we going to fully vaccinate seniors before we move on to other younger, healthier workers? I've brought this up at each hearing, asking you and the governor to be more transparent about how he's deciding who is getting the vaccine, especially when there's a limited supply. MDH representatives have consistently evaded this question, and I honestly don't understand why there's no transparency. This doesn't seem to be a problem in other states. For example, right now in Wisconsin, the public can easily see the state's current eligible groups and a list of the next eligible groups. And you saw it in the AARP letter, Indiana and Virginia doing it much better. In Wisconsin, the current eligible populations include residents and staff in skilled nursing and long-term care facilities, adults 65 and older, frontline healthcare personnel, and police and fire personnel. And you can also see very plainly on their website who is going to be next. Not we'll decide later, but it says who is going to be next. Then they go education and childcare, Medicaid long-term care programs, public-facing essential workers, non-frontline essential and healthcare personnel, and facility staff and residents in congregate care living. You can also see exactly how they plan to make those changes. They have a plan over in Wisconsin. And DHS anticipates that the following groups will be eligible for the vaccine around March 1st. They're getting a date in Wisconsin. And I also learned plainly from their website that if they're expecting a large pickup in federal allocation of vaccines beginning March 9th, they say we're going to be getting a lot more March 9th. We don't see any of that on our website. So it feels like all of this information that you're getting is being locked up in this vault. And even during our legislator only calls, there's been some frustration, a lot of frustration that we are not getting the information. And finally, Wisconsin's keeping it very, very simple, using healthcare providers and pharmacies as the prime vaccinators and for the senior population. But back to Minnesota, to my question, I've asked several times in the past few weeks, what is next? Can you assure the Senate Aging and Long-Term Care Committee that the Minnesota Department of Health will not add any additional groups until all 918,000 seniors 65 and older around the state are fully protected and have had the opportunity to be vaccinated? And what about those 50 and over, when again, I said they're 98% of the state COVID deaths? The answer in writing on February 17th hearing was the governor is considering those recommendations. In past discussions, I don't know what that means. He's considering, but before you tell me again that he's weighing his options and you can't tell us anything, I just really want the public and the committee members to see the governor's comments that were made yesterday during a press conference where he announced significant outreach and vaccination efforts for minority groups. So staff, can you play that clip, please? We're not getting any sound. Oh, wait, maybe now we will. Dang it.
Still no sound, Madam Chair.
No sound, Susie. Hate technology. There we go. It was on mute, Susie. Try that again. All right. Let me know if you have it.
Madam Chair, I'm happy to speak to,
All right, go ahead,
Fine.
Commissioner Malcolm.
yeah, I think the governor was up at Shiloh Temple in North Minneapolis, and we were talking about grants that we have made to community-based organizations to help us make sure that people who've been particularly hard hit are in the pandemic with higher rates of exposure, worse outcomes, are getting accurate information and getting help to get connected to vaccine when that it becomes available. Some of the leaders, the religious leaders and community leaders that were there have been working hard to vaccinate elders in their community. So it's not inconsistent with saying, who is most vulnerable. And we know the importance of working with faith leaders, with churches, getting the whole goal here as a vaccine supply grows is to push more and more vaccine out through this very diversified vaccinator ecosystem that we have. It is one of our strengths, and we intend to fully use every one of those channels. Our healthcare providers, our pharmacies, community pharmacies, local public health, community-based organizations, the ability for the state to have sites that are focused on particular populations or able to be stood up quickly should there be a bolus of vaccine that comes available. So that these goals are not should not be in competition with each other. They're very much mutually reinforcing. As we go through each successive population group, looking for those most at risk within that group is going to be important. So I think what we were talking about yesterday was the importance of having appropriate education and outreach that can help to reach some of the populations that won't be reached by the connector, as an example, or any of our more broader, more general messaging. So I don't think it's inconsistent with the notion of making sure that the most vulnerable folks, elders in this case, are getting vaccinated.
What he said in that clip yesterday was that he was going to move on after 60% of the seniors were vaccinated. You think you've got sound, Susie?
I'm gonna try it. Nope. Darn it. I guess what I was questioning what you just said is when you say these communities are particularly hit harder and higher rates of contracting the virus, is the percentage of deaths in these communities higher than 98% of those in the whole state in one Minnesota of dying from 98% are over the age of 50 in these particular communities that are harder hit, as you say, higher than that, like that, to further dilute the vaccine because he's hit 60% of the seniors vaccinated. The other 40% you're on your own because now we're opening it up to everybody. That's a message that's hard to tell seniors when, again, they're scrambling everywhere trying to find it. Again, 5 texts while I've been sitting here. Can you find me a place? Karen, can you post your Thrifty White? I'm posting Thrifty White yesterday. They're going to my Twitter to sign up at Thrifty White for the vaccine. So to say these communities are particularly harder hit, can it be any harder hit than our seniors?
No, thank you, Madam Chair. And what I was meaning to say there is you look at any age group, and within that age group, including our elders, the rates of hospitalization and death for certain populations is multiples of the white population in that same age group. So that the point is, if we're talking about vaccinating our elders, it is very important to do some extra effort to vaccinate in the African American, Asian Pacific Islander, and Latinx communities to reach elders in those communities, because indeed they are being hospitalized and dying at significantly higher rates than the overall 65 plus population. So again, it's part and parcel of the strategy. It's not in opposition to it.
Commissioner Malcolm, I guess I would like to see that information on the website because we searched for it and cannot find that. All of these communities that the governor is setting these sites up at. I didn't see anybody harder hit than our seniors across the whole state of Minnesota at risk of dying.
And we agree, Madam Chair. That's why 65 plus was made a priority in the middle of January. And, to the point of saying at what point, do we are going to keep prioritizing seniors. At what point do you start adding in other eligible populations? We've been talking about people with underlying conditions in this committee. I know you all have concerns about younger people at higher risk. So at what point do we start adding additional populations in? Does not mean that the previously eligible population is not still a priority. We will absolutely continue to prioritize and look for and do outreach to seniors, even as additional populations start becoming eligible. Because we, at a certain point, I mean, and you know very well that not all seniors who've been offered the vaccine, even in long-term care, have taken it. We're thrilled that the vast majority of residents of skilled nursing and assisted have chosen to get the vaccine. We know how critical that is for their protection, but it's 100%. And so we need to keep doing that outreach and encouraging elders to get vaccinated. But as you know, it's not a requirement. And so I cannot tell you that we're not going to vaccinate anybody else until all 980,000 seniors are vaccinated.
Right. And I think at what point do you start looking into other sectors is when 100% of the seniors who want it, they all get it. That's when I think you can start looking. But we'll just agree to disagree on that. Senator Curran, and then we'll wrap up because we have a bill.
Thank you, Madam Chair. And this is a question that we were looking for from the perspective of the overall process. And we keep struggling every week to figure out what keeps driving the decision-making process, who's actually providing the services, picking a vendor. So Vault Services has been your selected vendor. A couple hundreds of millions of dollars have been awarded to Vault through no bid contracts. And the question I have is, do we see a conflict and do we have challenges, and what's influencing overall decision in this entire pandemic response from the entire administration? The challenge I have, and I think our citizens should be concerned with, is this company has recently, or in the past few months, hired a congressional candidate, Dan Feehan, to help run the vaccination program, which covers Minnesota and nationally. They also hired his campaign manager. They also hired Governor Walz's former deputy chief of staff, who are now the key lobbyists at this Vault company. And the Department of Health, Department of Human Services, and the governor's administration have awarded hundreds of millions of dollars. And so I just keep questioning, we get this, we struggle to get accurate in data that we can all believe in so we can work on this together. But when you see all of those appointees and the political allies, I think our citizens should be very concerned with who's driving the decisions, and shouldn't we be concerned that we issued hundreds of millions of dollars in contracts to people who are political allies of this administration? I think that's a question we're going to need to have answered by Commissioner Malcolm and the governor. So we'd love your comments on it.
Commissioner Malcolm.
Madam Chair and Senator Curran, I'm sorry, I'm not familiar with the appointments that you're referring to, other than Mr. Feehan. I don't have much comment on that assertion. But let me just tell you where the relationship with Vault started. Back when we were building up our testing infrastructure, Vault Vault is the company working with Yale and in a laboratory out there, developed the first FDA approved or EUA granted saliva test. And it was the most accurate alternative to a much more cumbersome PCR test at that time. So we chose them on the basis of the accuracy of their and the effectiveness of their saliva test to complement the PCR testing infrastructure at that time. So the relationship, as I think you probably are aware, began on the testing side and has, I think, put Minnesota in an extremely good position to have a really robust and diversified testing system. So I'm happy to
Madam Chair.
talk
Madam
more
Chair,
about.
very quick follow-up. Quick follow-up. Thank you, Madam Chair. So you're telling us that there were no Minnesota companies eligible that could have provided these services, and then regardless of the capabilities, I think there's a huge challenge in the political perception that we've awarded hundreds of millions of dollars in no-bid contracts to people who have direct political allies and political desire to continue to run for Congress. So I think the administration should make sure that perceived or real that those things never occur. Thank you.
Thank you, Senator Coran. And we do have to wrap this up because we have Senator Utke waiting to do his bill. But I do want to know what is going to be next. What is the plan? Seniors want to know what's the plan for how many vaccines are you getting? When can they get it? And I want the public also to know my recommendations to the governor. I recommend first taking all those questions off the vaccine. I'm actually demanding to get those questions down because it is so bothersome that government's collecting that kind of data. I recommend that the state not move on to expand to any other groups of younger workers until only after 95% of our seniors are fully covered, assuming that that's their choice. And a portion of them we know will decline the vaccine, although we know we're up over 90% are asking for it. I want a seniors first plan, since again, 65 and older make up 89% of our deaths, and 50 and older are 98% of our deaths. I recommend that the governor open it up only next to those with medical conditions 50 and older. I also recommend in the next few weeks that seniors finally get prioritized, and it's an all hands on deck approach to the 95% of available vaccines get into the arms of our seniors. Work at the local level, make it simple. In my suburb and communities around the state, bring the vaccines to them. Have local pharmacies or local public health hold vaccination events at senior centers like they're doing in other states. Use community pharmacists to bring it to the homebound seniors, and focus your outreach on partnership efforts on seniors so no one that wants a vaccine is left behind. If you could please, Commissioner Malcolm, come back again. We need to be having these conversations in public. The public needs to hear these answers. And if you could answer just before you go, will you commit to any of these recommendations, and what is next for the vaccine plan for seniors going forward?
Madam Chair, we always appreciate your input and your recommendations. I am not able to commit to specific recommendations. We agree, though, that we are now in a place where we we have much more certainty now about the federal supply. It's much more responsible to begin to roll out the path for not only who's next, but generally speaking, what with the vaccine supply that we can now see when people can expect that. I think that's quite a recent development that we've had that clarity about the supply. So we agree that it's timely to lay that path out now, and we are working on that as we speak.
Thank you, Commissioner Malcolm. I'll look for that information to be public. Thank you so much for coming. I really, really appreciate it. And I'm hoping you will come back. I know these are tough questions, and I know it's not your decision. It is the ultimate responsibility of the governor. So I really appreciate you coming. And I look forward to seeing you again. Thank you.
Thank you, Madam Chair. We will be back. Thank you.
Thank you. Next.